rates have continued to increase, and we now have above 80% of the eligible population with at least one dose of COVID-19 vaccines in every province and territory, which bodes well for further increasing protection for Canadians nationwide. And public health measures have continued to prove effective in slowing the spread where the virus is surging, despite the presence of the game-changing Delta variant. Nevertheless, over the past month, lessons have been hard learned where measures were relaxed too much or too soon, and especially where vaccination coverage remains low, providing further cautionary tales on the relentless behavior and severe impacts of this virus. As we head into Thanksgiving weekend, faced with very different epidemiological situations, depending on where we are or will be in the country, this update is a reminder that although we've made important gains, we'll need to maintain basic but essential precautions to see us safely through the respiratory infections season ahead. So Canadians, whether fully vaccinated or not, are urged to continue heeding local public health advice and be vigilant with well-practiced precautions that keep us safer indoors, including masking, avoiding crowding, and improving ventilation. On slide 1, since the previous modeling update, the average daily case counts have increased, but at a slower pace than had been forecasted last month. Public health measures reapplied in late August and September to slow the acceleration of the Delta variant transmission have helped to bend the curve, with daily cases leveling off in recent weeks at the national level. Over the past week, there were an average of over 3,700 new cases being reported daily across Canada, compared to the over 8,500 daily cases forecasted by mid-September based on our previous trajectory. Unfortunately, severe illness outcomes occurring primarily among unvaccinated people are still elevated. On average, over the past week, 2,500 people with COVID-19 were being treated in our hospitals each day, including 770 in intensive care units, and 38 deaths were reported daily.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux épidémiologiques et de modélisation effectués au pays qui orientent la gestion continue de la COVID-19 au Canada. Malgré les défis bien réels que nous avons à relever alors que la vague actuelle
challenges being faced at the height of the current wave, the efforts we've made give us reason for optimism, but we must remain mindful of the need for continued caution in the months ahead. Nationally, vaccination rates have continued to increase, and we now have above 80% of the eligible population with at least one dose of COVID-19 vaccines in every province and territory, which bodes well for further increasing protection for Canadians nationwide. And public health measures have continued to prove effective in slowing the spread where the virus is surging, despite the presence of the game-changing Delta variant. Nevertheless, over the past month, lessons have been hard learned where measures were relaxed too much or too soon, and especially where vaccination coverage remains low, providing further cautionary tales on the relentless behavior and severe impacts of this virus. As we head into Thanksgiving weekend, faced with very different epidemiological situations depending on where we are or where we will be in the country, this update is a reminder that although we've made important gains, we need to maintain basic but essential precautions to see us safely through the respiratory infection season ahead. So, Canadians, whether fully vaccinated or not, are urged to continue heeding local public health advice and be vigilant with well-practiced precautions that keep us safer indoors, including masking, avoiding crowding, and improving ventilation. Dr. Tam already spoke about slide 1. So now for slide 2. The 6 most populous provinces illustrate some of the considerable variation in disease activity experienced during Canada's fourth wave. Previously hard-hit provinces that maintained restrictions while striving for high vaccination coverage experienced a relatively smaller fourth wave compared to previous waves. Other areas that relaxed too many measures too quickly before high enough vaccination coverage was achieved experienced a sharp and large rebound in disease activity, followed by a similarly sharp increase in severe illnesses that continues to place a heavy strain on the health system and particularly critical care capacity. Not illustrated here are other areas of the country where spread has been well contained during most of the pandemic, but where localized introductions into areas with lower vaccination coverage have resulted in rapid community spread.
Slide 3. In recent days, following weeks of tightening public health measures in heavily impacted areas of Canada, the national RT, or reproduction number, has dropped below 1. This means that for the first time since mid-July, the epidemic has dropped out of a growth pattern nationally. However, RT has only just fallen below 1 nationally, and it may still be at or above 1 in some areas. To bring the epidemic under control, RT needs to be maintained consistently below 1.
Diapositive 4. Depuis le début de la
Slide
vaccination à la mi-décembre,
more than 56.8 million doses of COVID-19 vaccines have been administered across Canada since vaccination began in mid-December, providing over 88% of the eligible population aged 12 years or older with at least 1 dose of COVID-19 vaccine, and over 82% of eligible Canadians are fully vaccinated. Covering this last stretch to achieve high vaccination coverage across all eligible age groups in all areas is crucial to reducing the impact and severity of the Delta-driven wave in communities across the country. Further increasing vaccine uptake, including for first doses, will require public health and communities to hone targeted outreach approaches that reduce barriers, provide support, and reach people where they are. Everything from mobile clinics and drop-in access to more locations, information, language, and cultural outreach resources can make a difference to getting more of the population informed, confident, and protected. Nevertheless, where there are pockets of under-vaccinated people, there is an ongoing risk for rapid community spread, high numbers in hospital and critical care, strain on the health system, and a worrying potential for emergence of new variants of concern.
On slide 5. Although vaccine coverage has increased across the age groups, with over 84 to 95% fully vaccinated coverage in adults aged 50 years or older, vaccination coverage is lower in the younger age groups, leaving a significant protection gap. Not surprisingly, infection rates continue to be highest in these younger age groups. Although COVID-19 has generally been less severe in younger people, serious or prolonged illness can occur in any age group, and with the more severe Delta variant predominating and very high numbers of people infected, serious illness is being seen more often. Increasing vaccine coverage is not only important to reduce the pool of susceptible people and lessening the impact of the Delta wave, but also to limit the spread to children too young to be vaccinated and into schools and beyond. For parents of children under 12 years, Getting yourself vaccinated is an important way to contribute to their protection against COVID-19 and help keep them in school and doing the activities that they love. There are still nearly 6 million eligible Canadians that are not yet fully vaccinated, and this is why we must continue to increase vaccine coverage and protect everyone we can.
Diapositive 6.
Slide 6. Health regions that have achieved high vaccination rates, most of which maintained a range of measures to slow transmission rates while coverage was building, have been able to keep infection rates lower. These regions are now in a stronger position of having high vaccine coverage and low disease incidence, seen as the green and blue areas on the map. On the other hand, areas with lower vaccination coverage, particularly those that eased measures too soon or too quickly, are experiencing very high incidence, including severe illnesses and resulting strain on the health system. These regions are in a challenging position of having still too low vaccination coverage with ongoing high incidence, seen as red and purple colored areas on the map. Heading into the respiratory season with healthcare capacity already under heavy strain increases the urgency for a combined approach of maintaining public health restrictions to slow the spread and rapidly increase vaccine uptake to protect more people from severe illness. However, even areas with moderate to high vaccination coverage need to maintain basic precautions, such as masking and limiting gathering sizes, while ensuring a quick response to any rapid increase in cases, as we spend more time indoors over the coming months.
Slide 7. When you are vaccinated, you reduce your risk of serious illness, hospitalization, and death due to COVID-19. Remember, a vaccine takes time to work. It typically takes about 2 weeks following the second dose for the immune system to build up protection. The latest data continue to demonstrate that fully vaccinated people are much less likely to become infected and are highly protected against severe illness due to COVID-19. From mid-August to mid-September, the average weekly rate of COVID-19 cases was 10 times higher in unvaccinated people than in fully vaccinated people, while the average weekly rate of hospitalized cases was 36 times higher in unvaccinated people compared to fully vaccinated people. This aligns well with ongoing vaccine effectiveness studies that demonstrate strong protection against severe illness among fully vaccinated people. As well, based on the continuous close monitoring of COVID-19 vaccines in use across Canada and worldwide, we know the vaccines are very safe and that vaccination remains our best protection.
Diapositive 8.
Slide 8. This updated, longer-range forecast shows how the epidemic trajectory may evolve through early November. While uncertainty remains, it provides a cautiously optimistic outlook for the coming weeks. If we continue along the path we are on now, by maintaining vaccine uptake and sustaining existing public health measures, including those reapplied where the virus is surging, this updated model shows we could expect to see a decline of the Delta-driven wave along the dark gray line trajectory. This represents a significant improvement over the trajectory shown in our previous modeling in early September, when cases were forecast to resurge rapidly. Fortunately, reintroduction of public health measures in many areas of the country has helped to slow transmission in some heavily impacted areas, as reflected in a flattening of the national trajectory. Nevertheless, many areas of the country have experienced rapidly rising cases with a consequent increase in severe outcome trends. Hence, it is important to underscore that if current public health measures were relaxed such that transmission rates increase up to 15% higher than present levels, the forecast predicts we could see a resurgence of cases along the blue line trajectory. This forecast reaffirms the importance and impact of core public health and personal protective measures like mask wearing and physical distancing, even at current levels of vaccination.
Slide 9. With the level of vaccine coverage that we have achieved in Canada to date, we are much better protected going into the respiratory infection season. And today's modeling update shows that by maintaining basic and less restrictive measures, such as masking and limiting close contacts, we could reduce the impact of COVID-19 this winter. However, the scenario on the left shows that if we let go of these basic public health measures through fall and winter, we could have a serious Delta-driven resurgence with a risk of overwhelming healthcare capacity. Whereas, by keeping these basic protective measures in place, as shown in the scenario on the right, we could reduce the risk of a large wave exceeding healthcare capacity. In this preferred scenario, sustained efforts could minimize severe outcomes and lessen societal disruption by reducing the overall number of cases, hospitalizations, critical illnesses, and deaths due to a very large resurgence. Nevertheless, it is important to stress that even as the fourth wave recedes, COVID-19 is unlikely to disappear entirely, and there could continue to be bumps along the way. Experience in Canada and worldwide throughout the pandemic has shown us that what works best is ongoing vigilance and a combined approach, including achieving high vaccine coverage across the population, making indoor spaces safer with improved ventilation and good adherence to individual layers of protection, such as masking and spacing, and closely monitoring and quickly reapplying public health measures to slow rapid spreads and minimize severe illness where the virus is surging.
Diapositive 10.
Slide 10. Although several jurisdictions are still facing considerable challenges, this update reaffirms that by achieving a strong foundation of protection, with over 82% of eligible Canadians fully vaccinated, and applying public health measures, epidemic growth can be managed. Nationally, case counts have leveled off, but are still high overall, and infection rates are exceedingly high in several areas of the country. With the increased severity of the Delta variant, this wave is making more people very sick, resulting in a heavy strain on the health system where the virus is surging. As we head into Thanksgiving weekend, Canadians are urged to keep gatherings small and to follow local public health advice based on the local epidemiological situation. We can all make indoor gatherings safer by ensuring that eligible people are fully vaccinated, taking steps to improve indoor ventilation, and using precautions such as masking and physical distancing, especially if some family members cannot be vaccinated. In the case of eligible people who are not yet fully vaccinated or have chosen not to get vaccinated, it is recommended to limit indoor gatherings to household members only or to have outdoor gatherings where possible. The key challenge for this winter will be to consistently continue what we've been doing. Protecting our progress and ensuring greater safety in the months ahead means keeping up with basic best practices in all our interactions, which can also help prevent other respiratory infections we may encounter this winter.
Merci, Miigwech.
Slide 10. Although several jurisdictions are still facing considerable challenges, this update reaffirms that by achieving a strong foundation of protection with over 82% of eligible Canadians fully vaccinated and applying public health measures, epidemic growth can be managed. Nationally, case counts have leveled off, but are still high overall, and infection rates are exceedingly high in several areas of the country. With the increased severity of the Delta variant, this wave is making more people very sick, resulting in a heavy strain on the health system where the virus is surging. As we head into Thanksgiving weekend, Canadians are being urged to keep gatherings small and follow local public health advice based on the local epidemiological situation. We can all make indoor gatherings safer by ensuring that eligible people are fully vaccinated, taking steps to improve indoor ventilation, and using precautions such as masking and physical distancing, especially if some family members can't be vaccinated. In the case of eligible people who are not yet fully vaccinated or have chosen not to get vaccinated, it is recommended to limit indoor gatherings to household members only or to have outdoor gatherings where possible. The key challenge for this winter will be to consistently continue what we've been doing. Protecting our progress and ensuring greater safety in the months ahead means keeping up with basic best practices in all of our interactions, which can also help prevent other respiratory infections we may encounter this winter. Thank you. Merci. Miigwech.
Merci, Dr. Tam and Dr. Njoo. Thank you. We will now open the telephone line to questions. We ask that you limit yourself to one question and only one follow-up. We'll be taking questions in both official languages. Nous allons maintenant prendre des questions. Nous vous demandons de vous limiter à une question et une question de suivi seulement. Vous pouvez poser vos questions dans l'une des deux langues officielles. Donc, commençons la session. Operator, first question.
Thank you. Merci. You may press star 1 if you have a question. Vous pouvez appuyer sur étoile 1 si vous avez une question. La première question est de Louis Blouin.
First question from Louis Blouin from Radio-Canada.
Oui, bonjour. Une question pour le Dr. Njoo.
I have a question for Dr. Njoo and Dr. Tam as well, if you'd like to weigh in.
J'aimerais vous entendre sur la nécessité d'une troisième dose.
I'd like to hear you talk about the need for a third dose or a booster shot. This was published in the New England Journal of Medicine. Do you notice that it is necessary in Canada to have a third dose for the general population? What is your decision on this? Thank you for the question. That is an important question. Here's what I can tell you now. We are continuing to have good discussions with our counterparts in the provinces and territories. Together, we are continuing to analyze the facts in Canada and around the world. Over time, immunity will decrease in the general population. But what we can see here in Canada is that, in general, we still have a good protection, especially when it comes to severe illness in the general population. So a booster shot is a question that we're looking at, and we will continue discussions on it. In certain areas, we see a resurgence and severe illness. If we begin to see that in fully vaccinated populations, that will have an impact on our decision. Also, experts continue to analyze the facts and data. And as they do so, it is possible that we will adapt our approach. But for the time being, we are more looking at priority populations getting a booster shot. For example, a population at a heightened risk of complications, but for the general population, we have not taken that call yet. Thank you. Follow-up question? I'd like to hear you talk about the Merck antiviral pill against COVID-19 symptoms. Some other countries are signing deals with Merck, but Canada still has not signed a deal to purchase this medicine. Is there a risk of missing the boat on this? And do you think that this pill can be have as important an impact on fighting the virus? Thank you for another good question. We've looked at scientific and clinical data, and this, or rather, and we have followed what the company has published on this to date. This is an orally ingested medication. And usually, I think it's a dose of 4 pills twice a day for 5 days. In the beginning, it can reduce symptoms and decrease the risk of hospitalization.
Avec les autres traitements déjà disponibles dans un hôpital.
We are now in talks with the company in order to better understand the fact-based data that is currently available. They have held a clinical trial, and it will be important to know what the results of that are. Also, since August, the company has submitted a file to Health Canada, and Health Canada, on its side, is also processing that information, and they're doing so expeditiously, I would add. So we are continuing our discussions with the company. And in regards to what you mentioned, yes, other countries are negotiating contracts with the company, Merck. But in Canada, we too are looking at an advanced purchase agreement. But as of right now, we are in the early stages of our discussions with Merck. As we see it, this really is an effective treatment, and it is another strong tool to have in our toolbox in fighting the virus. So Canada may purchase this medicine. Thank you. Thank you.
The next question is from Michael Couture from Global News. Please go ahead.
Doctors, thank you very much for doing this. I wanted to ask you, you mentioned near the end in slide 10 about Thanksgiving. Some Canadians might, though, be scratching their heads and trying to make sense of different restrictions that we're seeing across the country for social gatherings this weekend. You have Saskatchewan that has the lowest vaccination rate, but no restrictions for private gatherings, whereas provinces with higher vaccination rates seem to have stricter limits. So what are you suggesting people do for this holiday? And I wanted to know from each of you, what will you be doing Thanksgiving this year? Because it is different from last year.
Yes, thank you for the question. And it is a different epidemiologic situation across the country. But you pointed out that different jurisdictions have also chosen to put down different measures. But our advice really is that overall, keep indoor gatherings safer by, asking your guests. It is a difficult question sometimes, but ask your family, or if you had people outside of your family that you're thinking of inviting, do try and ask them whether they've been vaccinated or not, and take that into account. And put down some basic measures, such as improving indoor ventilation. Even when it's cooler, you can open your windows a little bit for short periods of time and the doors to help improve indoor ventilation. Use precautions, including spacing or physical distancing if you can, and masking where appropriate if some family members, particularly who have high-risk conditions. But different families will have a different level of common risk tolerance, if you like. So it requires a bit of discussion, but keeping gatherings generally small and respecting these basic measures are recommended, I would say, anywhere in Canada while following local public health rules. If you're not fully vaccinated, or as we said, then we really should be limiting the gatherings to your household members and having things outdoors as much as possible. So this will keep the country, as you just seen, the curve is just bending. And if you're in some of the provinces in the middle of the country, you need to be really, really precautionary. I think over this weekend, previously we have seen surges in cases after these holiday events. So this year with the vaccine on board, I think we should be on a better, more solid footing, but we can't, be too careful when it comes to this formidable foe, as I've said, the Delta variant. In terms of this Thanksgiving, at this point, I have no specific plans to have in-person interactions. I'll be doing most things virtually. And if I do anything, it will be with my immediate family, my parents, for example, who are fully vaccinated. And we have had very thorough discussions with my sort of immediate family members. But all to say is they're all fully vaccinated. And that gives us a little bit more in terms of our options.
It's Dr. Njoo. Maybe I'll add to Dr. Tam in terms of personal plans for Thanksgiving. So similar to Dr. Tam, both my wife and I are completely vaccinated, so that's fine. And we're planning to have in-person gatherings with some immediate family members who also, we've discussed with them, they're also completely vaccinated. So I think we're fortunate, even my children, I'm not sure if they actually listen to me or maybe based on other considerations, are fully vaccinated, and they're sort of in that prime age group, millennials, sort of in their sort of early to mid-20s. So I think we're fortunate, but I will state, that I've had conversations with friends who are having a tougher time, with, let's say, especially members of their family who are not vaccinated at all or only partially vaccinated. And I've made it clear that my advice to them, as we've actually stated here, is that, such a gathering should be limited to the immediate household. If let's say it's a family member is not vaccinated, you should politely explain your situation and your discomfort level. And if they choose not to be vaccinated, that's their choice. But there are consequences in terms of even family dynamics and others feeling safe about getting together. So I'll leave it at that. But certainly my personal plans is to have small in-person gatherings, all of us fully vaccinated. Thanks.
Thank you, doctors. Follow-up, Mike?
Yeah, first of all, thank you for sharing that personal information. As my follow-up, I wanted to know, we're getting into that time of the year where snowbirds and other Canadians can start planning their trips down south and elsewhere. So I wanted to know what work is being done by Health Canada with other countries to ensure that fully vaccinated Canadians, including those with a mixed dose regimen, will be allowed into other countries, especially when we consider a great number of Canadians got the AstraZeneca vaccine, and that still isn't approved in countries like the United States.
Yes, thank you for the question. It's something that is uppermost on many Canadians' minds. We have been extremely active in engaging key countries in accepting the schedules that we have been deploying in Canada, which includes mixed dose schedules as well as a stretch interval. The stretch interval probably isn't as much of an issue because there's a minimum interval, but most countries will accept longer intervals. So we've been in contact with countries that are sun destinations, for example, where the majority of them either don't have vaccine requirements at the moment, or they would accept the Canadian vaccination schedules. But you do have to check with individual countries, but there are definitely options. With European countries, we've been having a lot of discussions, mainly with the health departments or the equivalent public health agencies, the European Centre for Disease Control, the European Commission as they're reviewing their policies, and the United Kingdom as well. And the United Kingdom has accepted Canada into one of their pilot streams where they would accept the schedule that we have. Many other European countries already use mixed schedules, so there shouldn't be a problem with probably over a dozen countries in Europe. But I think, again, check before you go. So then comes your more precise question, which is about the United States. So this is one of the most active areas of discussion in terms of the country that we're most interested in. And with the CDC, the NIH, the Health Human Services overall at every level, we've presented the information that we have about our schedules and how they've been working for us, as well as the international literature showing the efficacy of and safety of these schedules, particularly, for example, the AstraZeneca vaccine followed by a mRNA vaccine actually gives you a better vaccine effectiveness than maybe even the homologous 2-dose AstraZeneca vaccine, and particularly with our stretch interval. So we are hard at it. The United States, as you know, is going to begin to put down some vaccine requirements at the beginning of November. They are still working everything through at their end. So we are waiting anxiously to see what they will be doing at their end. But let's just say we have left no stones unturned to advocate for the vaccine schedules here.
Thank you, Dr. Tam. Operator, next question. Prochaine question.
La prochaine question est de Olivier Ferrand-Boissé de TVA Nouvelles.
Question from Olivier Ferrand-Boissé from TVA. Good day to both of you. My question is for Dr. Njoo. Dr. Scott Dudley from the United States has said that, in his opinion, the pandemic could end once vaccines are available for children. We also mentioned the Merck pill earlier. What is your take on this? Do you hold on hope for that post-pandemic phase? Thank you for the question. I can't comment on what others may have said, but in my opinion, and in Dr. Tam's opinion as well, I believe, and as many experts believe around the world, we have a pandemic. A pandemic is really something major worldwide. In Canada, we have done well to date with our vaccine coverage. Our rates of severe illness compared to that of other countries is good. But as we say, no one is protected as long as everyone is not protected. Travel between countries is an important issue. Even if here in Canada we have done well with an 84% vaccination rate or higher, in other countries, vaccine coverage is not nearly so high. So much work is left to do. That goes for every country, but it also goes for cooperation between countries. I believe that Canada contributes to the international effort by sharing vaccines with other countries, for example. But we can't rest on our laurels. We need to keep striving to strike a balance. And there will always be options to use other tools like emerging medicines to fight COVID symptoms. But we know that prevention is always preferable to dealing with the illness once it exists. We may use the Merck pill in the future, but as of yet, that has not been approved for use in Canada. I think we are far from declaring the pandemic over. How will it happen? Well, perhaps in Canada, we will have different levels of manageability. That may be the same case in other countries of the world. Experts may call it an endemic situation, but we are not there yet, and we need to continue increasing our vaccine coverage. Thank you. Follow-up question? Yes. I would like to come back to the forecasts compared to the last update. We're looking at 3,700 cases now. That is, there is a discrepancy with the previous forecasts. Could you explain that? Yes. When it comes to forecasting and modeling, trends are based on the behavior of Canadians.
Les bonnes mesures de santé publique, je pense que dans plusieurs régions du pays.
We can chalk it up to
les Canadiens et Canadiennes
good practice of preventive measures in many regions of Canada, and also to Canadians who have used good personal protection practice. We are optimistic. The summer was relatively good, but now we need to be cautious because autumn is setting in, and the Delta variant of concern is highly contagious. Therefore, I feel everyone must still continue to follow public health measures, and we must strive to increase vaccination coverage. That is very important. We have seen unfortunate examples in some provinces where their intensive care units and other parts of their healthcare systems are under significant strain. That is a hard-learned lesson. We should remember that to try and prevent it in other regions. Thank you.
Next question. Prochaine question.
The next question is from Stephanie Taylor from the Canadian Press. Please go ahead.
Hi, doctors. Thanks for making the time to talk to us this morning. I wanted to ask about some reports from other countries about what to do when it comes to the Moderna vaccine for those under 30. Other countries have reported pausing this because of health concerns or potential outcomes. Can you detail what Canada is doing on this front? Are you considering recommending that those 30 and under maybe don't get inoculated with Moderna?
So the safety of the vaccines are really very important, and any signal is worth the investigation. So in Canada, as we follow the number of reported events after vaccination, we have detected an increased rate of myocarditis, that is the heart inflammation, after the Moderna vaccine, especially after the second dose in younger individuals and especially in males. And so that's a sort of observation which is, I think, in line with what's been observed in a number of countries. Right now, in balancing the risk and benefits, the National Advisory Committee on Immunization indicated that we should explain to individuals the risk of adverse effects such as myocarditis, but that the Moderna vaccine can still be offered to individuals age 12 and older. But we will be, of course, watching the situation quite carefully. I would say that between the age of 12 to 17, the majority of Canadians have received the Pfizer vaccine simply because of the way that the vaccine programs rolled out. Having started with the Pfizer vaccine, many of the youth have been vaccinated with that particular vaccine. So we haven't really been observing a lot of adverse events following Moderna necessarily in that age group, but more in the younger adults. But in any case, I think informed consent is very important and should be provided to the individual that you are providing the vaccine to. But that's where we're at the moment. And just to emphasize that we have some really effective vaccines. Moderna is a very effective vaccine, and in certain age groups may actually seems to have a higher vaccine effectiveness, perhaps given the higher mRNA content in that vaccine. And so you have to actually balance the risk and benefits depending on the situation and the patient that you have.
It's Dr. Njoo. Maybe I would just add to what Dr. Tam said, and I think we can certainly look at the sort of the relative risk, and it's for a very rare event overall, in terms of between the two mRNA vaccines, Pfizer and Moderna. But if you look at overall for all of the vaccines approved in Canada, they're very safe and effective. And although you could look at maybe relative differences between one vaccine versus another, at the end of the day, they're all safe and effective. They've obviously had a great effect in terms of protecting the Canadian population. If you look at the data we presented again, the most important, I think, lesson is to get vaccinated. Informed consent with whatever vaccine is offered. You can ask the questions, but at the end of the day, please get vaccinated. You can see with a relative comparison of rates for those vaccinated compared to non-vaccinated, especially hospitalization, 36 times. I can't think of a sort of a figure more compelling than that. Look at some of the videos you've seen now on TV with individuals in the ICUs who weren't vaccinated and now realizing how severe the illness can be. And hopefully they can also convince, maybe their friends and relatives, others who maybe might have been thinking like them before, that it is so important to get vaccinated. Thank you.
Thank you for that. Dr. Tam, you mentioned off the top that some hard lessons were learned in this fourth wave, specifically Saskatchewan, Alberta, are seeing cases surge after doing away with all public health restrictions. But even right now, Saskatchewan has chosen not to restrict gatherings for Thanksgiving. And I understand the advice you are providing, but that's still not a move the government has taken. So I'm wondering, do you think the Western provinces, Alberta and Saskatchewan, have truly learned the lesson from the fourth wave when it comes to removing health restrictions or keeping them in place?
Well, I think my general message is that you've got to be really careful right now. And the virus is still a very powerful virus, and you've got, quite a huge pockets of under-immunization in those areas. And I think, I would hope that if with this wave, that everyone has taken this to heart, and that things can be really serious. Look at the healthcare system and the fact that you have extremely exhausted healthcare workers. So one of the key indicators on top of the actual case rates and the escalation is the healthcare capacity to cope. And I think the difference moving on from the fourth wave and beyond It's just how stretched the health system is, and that you got to be really prudent because there's no way of replicating and multiplying that health human resource in such a rapid space of time. So I would urge all provinces and every individual to do their part, because your healthcare workers are exhausted. Healthcare capacity can be different from different regions, but it's pretty clear that in some of these provinces, they are really, really stretched. So I guess time will tell as to whether individual provinces have learned from the fourth wave, while the vaccine, of course, the coverage is increasing. You can't just rely on the vaccinations alone. I would have to just say that it is great to see a jump in the Alberta and to slightly lesser extent the Saskatchewan uptake of the vaccine, given all the efforts that they're trying to put in place. But you still cannot rely on the vaccinations alone at this point.
Thank you, Doctor. Operator, next question.
The next question is from Annie Bergeron-Oliver from CTV National News. Please go ahead.
Hi there. Today's modeling looks fairly positive, which is a nice change. And I'm wondering if you can tell me a bit about what type of a game changer it will be once children, young kids, will be able to get vaccinated.
Yes, thank you for that question. So there are different types of modeling that you saw today. One is the projections or the forecasts for the next several weeks. And that is very much dependent on how we've managed, how we've behaved in terms of the population and the vaccine coverage. And so 2 weeks ago would affect what happens, 2 weeks later, that people have got that concept now. So whatever's been done in the last few weeks has worked, but we mustn't let go of these measures quickly while our vaccination rates are going up. So that's that piece of forecast. The next slide you will see is one that uses a much more complex dynamic modeling. And that at the moment doesn't have children vaccination, the vaccination of the younger kids injected into that model. I know that when our modelers are beginning to work at this, you will find that if you have kids age 5 to 11 vaccinated, it will make a difference over the longer term in terms of transmission. For this fourth wave, of course, it's a bit late for that, but for subsequent waves, you may see it reducing the peak of a wave, or perhaps reducing the duration of any subsequent bumps that you might have. It is the modeling information is just being pulled together right now. So we might see some of that going into the future modeling sessions. But it will have some impact for sure. But primarily we want to vaccinate kids because the vaccine offers them good protection against being infected themselves. And even if serious outcomes are rare, some kids will get seriously sick. The other thing is that we don't understand enough at this point in time about prolonged symptoms or long COVID in the pediatric population, or indeed as populations as a whole. But because some of these long consequences and symptoms can occur even after a mild illness, that will have to be monitored very carefully. But I think the pediatric vaccines offer the next bright light or hope on our horizons, and it will add another layer of protection.
Okay, great. And as I follow up, I'm hoping that you can provide a little bit more context about slide number 9. Specifically, if I'm reading this correctly, it appears as though without public health measures, we see an uptick, and then it looks like cases go flat. Whereas with public health measures in the fall, it looks like we seem to have these small little waves, but it doesn't appear to go as flat as it does in the first scenario. I'm just hoping you can explain the differences there and why that's the case.
Yeah, so you're seeing hundreds and hundreds of simulations go through these scenarios, and I'm hoping I'm seeing what you're seeing, because some of the blurry sort of scenarios can be difficult to ascertain. But obviously, with the scenario on the right-hand side, the bumps are generally lower going forward. So you have to read to the right of the vertical lines. And so if you compared the right-hand side to the left, you'll get a smaller sort of fall and winter wave. And then you may get another bump later on. But what you're trying to do also is that if infections were going through the unvaccinated population, you don't want it to go through all at once. So some of these measures will reduce rapid transmission amongst the unvaccinated and really just stretch out those cases over a longer period of time, so that your hospital systems are less overwhelmed.
Thank you, Dr. Tam. Operator, is there any other questions?
There are no further questions at this time. Nous n'avons plus de questions pour le moment.
Merci beaucoup. C'est ce qui met fin à la conférence de presse pour aujourd'hui. That will be all for today's press conference. Thank you very much.